Hi everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. What is an ideal blood pressure? It's an important question, isn't it? We've all heard of blood pressure before, and the most commonly cited quote-unquote ideal number is 120/80. The top number is the systolic number, that's the 120, and that represents the maximum pressure as the heart contracts and blood surges into the great vessels surrounding the heart. That's the systolic blood pressure. The bottom number is the diastolic blood pressure, and that represents the minimum pressure as the heart relaxes and immediately before it starts contracting again, that part of the cardiac cycle. That is the diastolic number. And that's where we come up with the something over something, the systolic over diastolic blood pressure. And the more I think about this, the more I believe it's absolutely ludicrous that we would have this one-size-fits-all approach. Ideal blood pressure, 120/80. How can you have an ideal blood pressure for everybody? People come in different shapes and sizes, people are different ages, everybody probably has their own ideal blood pressure. So it's ridiculous that we would push this notion of an ideal blood pressure. I do not believe it has been truly thought through. And it seems like every passing year, the guidance from the medical establishment gets more and more aggressive. And I also believe on many levels, this is a complete money grab, especially by the US medical establishment that is absolutely fixated on pushing more and more pharmacological products to help out their big pharma sponsors. And this is likely causing harm. I really believe, especially in an older population, this push for strict blood pressure control is really not helping a lot of people as they get older. And I talked about this in a recent video in terms of blood pressure management in the hospital, but I also believe it applies as an outpatient when people are outside at home. Many people only get a blood pressure measured in a doctor's office, which is a bad idea because that's not always representative of what a true blood pressure is. Now, I'm not suggesting that you allow the blood pressure to drift up to exceedingly high levels. I think if the top number, the systolic, is above 170, 180, and the bottom number, the diastolic, is above 100, yes, you are then in a territory where for most people, it should be brought down with medication. However, it's that gray area where the systolic number, the top number, is between 120 to 140, 150, and the bottom number is between 80 and 100. I believe there's a lot of gray there, particularly when people are only getting their blood pressure measured in a doctor's office or a clinic. What you have to remember from a scientific standpoint is that it is natural for blood pressure to increase with age, especially over the age of 65. This happens for many scientific reasons, changes that happen to the body, including loss of elasticity of the blood vessels. Blood vessels tend to stiffen. There are hormonal changes. There are changes in kidney function. And a lot of this is a natural adaptation to the process of aging. And again, I'm not suggesting that you allow the blood pressure to drift up to dangerously high levels, but the question is, should we be overly aggressive in lowering the blood pressure? I know that there are a lot of people out there, especially in an older age group, who now are running at blood pressures systolic between 100 and 120, and I believe that we're being way too aggressive in bringing the blood pressure down with 1, 2, 3, sometimes 3 or more medications. And as for younger people under the age of 50, let's say, there is a school of thought which I actually subscribe to that nearly all cases of high blood pressure are due to insulin resistance. Not 100% of cases, but nearly all cases are due to insulin resistance. And I've made videos about insulin resistance previously, including how you test for it, blood tests like blood glucose, HbA1c, HOMA-IR. I put links to those videos down below. But we have a pandemic of insulin resistance. It's exploding across Western countries, primarily due to a poor lifestyle and a terrible diet high in ultra-processed foods, refined carbohydrates, and sugars. And insulin resistance leads to high blood pressure through a number of mechanisms, including impaired vasodilation, increased sympathetic nervous system activity, renal sodium retention, endothelial dysfunction, and activation of the renin-angiotensin-aldosterone system. But those are all very technical terms, which we can certainly save for another video. So what would be my advice then if you are diagnosed with high blood pressure and you're on medications or your doctor is thinking of putting you on medications? Well, first and foremost, as I just said, because so many cases are caused by insulin resistance, I would advise you to aggressively work on insulin resistance management through whatever lifestyle factors you can. Because most people out there, when they work on this and succeed, their need for blood pressure medications is greatly reduced. I've seen many people completely come off their blood pressure pills once they have successfully fixed their insulin resistance. So aside from that, and again, I'm not suggesting that you stop your pills or you do this without medical supervision, because many people, their blood pressures are very high and they are on blood pressure pills for a reason. But I would suggest that you get a home blood pressure machine. If you haven't purchased one already, they are very useful. And what I'd advise is that you measure your blood pressure for a couple of weeks, at least 3 times a day, in the morning, afternoon, and evening. You keep a record of your blood pressures, and then when you next go back to your doctor's office, make sure that when they measure your blood pressure in the clinic, also have your home machine with you to make sure that the two correlate, that your home blood pressure machine is actually showing the same reading that the blood pressure machine in the clinic is showing, because some of these home blood pressure machines are not even accurate. So you want to do that. And then once you have recordings of your blood pressure at home, you can go through them with your doctor, hopefully a trusted doctor, to see if any changes need to be made. And what I find is that there are a lot of people who will find that they are on blood pressure pills, 1, 2, 3, however many blood pressure pills, and they're regularly checking their blood pressure at home, and they're frequently getting systolic readings, that's the top number, between 100 to 120, which I believe is on the lower side. And particularly as one ages, this starts to cause a problem. Many people can start to feel weak, they can start to feel dizzy, many people can have fainting episodes, elderly people can fall, and many times it's because their blood pressure has dropped. So what I would encourage you to do, if you find that you're on blood pressure pills and your blood pressure readings at home are on the lower side, then go through this with your doctor and see if you can successfully wean yourself down from any of those medications. That would be my advice. But first and foremost, for most people out there, work on that insulin resistance. If you do that successfully, so many people out there can come off their blood pressure pills completely, which is a real win. Why do you want to be on blood pressure pills or any medication if you don't need to? Thanks everyone for watching. Feel free to comment down below. Let me know your thoughts on blood pressure control. Remember, unfortunately, huge segments of the medical establishment are completely and utterly corrupted, and one of the best things you can do for your health and well-being is take your health into your own hands for yourself and your family. Make those right decisions every day so you have the least possible chance of ever needing doctors, hospitals, or any healthcare interactions. I'm a doctor myself. That's my own personal goal. I have no desire to go anywhere near any healthcare facility aside from working there, obviously, but as a patient, I will do everything possible to avoid that, and I encourage you to as well. Thanks everyone again. Check out my Health Academy and my online program. Those links are down below, as is a link to my free newsletter. Do sign up for that if you haven't already. Hit the like button if you like this video and the bell button for more similar videos in the future. That really helps with the algorithm and getting these videos shared as widely as possible. Take care everyone, and we will speak again in the next video.